Good afternoon.
Is an international body which is the largest and oldest global organization dedicated to cancer and its eradication. 4th of February every year has been earmarked to celebrate World Cancer Day, making it an awareness to the public and to the stakeholders to take charge the whole year what they have progressed to eradicate, control and bring a happiness to the cancer patients. The World Cancer Day is an initiative against the cancer where the entire world unites together to fight against the global cancer epidemic. It takes place every year on 4th of February. It encourages cancer prevention, detection and treatment by raising awareness about cancer. It also presses the government all over the world to take action against the disease, public awareness, and day long the social media help to build more opportunities to expose.
And other partners and stakeholders in oncology care. Our campaign, which is called United to Notify, reflects this unified stand that cancer care is not just an individual fight, it is a collective responsibility, and together we must come and create a transformative shift in cancer detection, treatment and policy making in India. And with this, I urge every doctor, every healthcare worker, every researcher and citizen to raise their voice in support of this initiative. Let us ensure that no cancer goes unnoticed, no patient goes unsupported, and no opportunity to save lives is lost. Let's stand together, speak together, and act together. Thank you so much.
US, which has a cervical cancer policy. Notifying means that we get to know that India has a single policy when it comes to cancer, rather than leaving it to the interpretation and implementation to the state. Currently it's divided. Some states have a voluntary cancer notifiable status. Some of them do not have it notified, and some of them are trying to take steps to get it notified. But if we wait for years together, the ICMR recommendation is a decade old, asking it to be notified. If we just keep waiting for it to happen, when you have the ICMR as a governing body from Bangalore, which has given a recommendation saying what are the benefits of getting cancer notified, and having worked on it, I think it's high time that policymakers and lawmakers in this country take it seriously, because it's the same body that we have constituted to actually understand what is the impact of cancer, what is the underlying reason, the burden of cancer, and such a recommendation being brushed aside.
Many cancers. So I have done a lot of webinars on this, online webinars and even physical seminars. Even at IMA I have done public guest lectures regarding creating the awareness to the people about healthy lifestyle. I'm the member of Indian Society of Lifestyle Medicine. So I thank Apollo team to taking this great initiative. I am sure this will create a huge impact on the humanity. Thank you so much.
Level idea, first advantage is that it will enhance the data accuracy and ensure that every case is recorded and overall a realistic picture of the cancer's impact across the country is provided. Second is that it is likely to improve treatment protocols with standardized guidelines that help in delivering consistent and equitable cancer care. And last but not the least, there will be a strengthening of research and policy decisions once a national cancer registry is made. It will also boost funding and enable more personalized treatment approaches. In 2022, it's important to note that the Parliamentary Standing Committee on Health and Family Welfare recommended that cancer be classified as a notifiable disease. Today, while some states in the
dignitaries on the dais and people from the media, and you all know today is the World Cancer Day. So you are assembled here to spread the awareness about the cancer. You know, the cancer is the leading cause of death among public in India and abroad. Especially it is affecting the pediatric, children also. So it's quite alarming that it is affecting the children also. So in this context, we all should come together, corporate bodies and government and medical practitioners should come together, form a formula so that it will reduce the burden on the cost of the treatment. So the main aim of this awareness campaign, you know, the cancer treatment is very expensive. It may be chemotherapy, it may be radiotherapy, surgery. So since it involves huge burden on the socio-economic.
ಇವತ್ತು ವರ್ಲ್ಡ್ ಕ್ಯಾನ್ಸರ್ ಡೇ ಫೆಬ್ರವರಿ 4 ಇನ್ ಅಸೋಸಿಯೇಷನ್ IMA ಮತ್ತು ಅಪೋಲೋ ಕ್ಯಾನ್ಸರ್ ಸೆಂಟರ್ ಅಸೋಸಿಯೇಷನಲ್ಲಿ ನಾವು ಈಗ ಗೌರ್ಮೆಂಟಿಗೆ ಒಂದು ವಿನಂತಿ ಮಾಡ್ಕೊತಾ ಇರೋದೇನು ಅಂತಂದರೆ, ಸೊ ಕ್ಯಾನ್ಸರ್ನ ಒಂದು ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಆಗಿ ಮಾಡಬೇಕು ಅಂತ. ಸೊ ಕ್ಯಾನ್ಸರ್ನ ನೋಟಿಫೈಯಬಲ್ ಡಿಸೀಸ್ ಮಾಡಿದ್ರೆ ಅದರಿಂದ ತುಂಬ ಅನುಕೂಲ ಆಗುತ್ತೆ. ಏನಕ್ಕೆ ಅಂತಂದರೆ ಎಷ್ಟು ಜನ ನಮ್ಮ ಬರ್ಡನ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಎಷ್ಟಿದೆ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ ಇದರಿಂದ. ಸೊ ಮುಂದೆ ಏನೇನು ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಕ್ಲಿಯರಾಗಿ ಮಾಡ್ಕೊಳ್ಳೋವಂಥದ್ದು, ಯಾವುದೇ ಮುಂದಕ್ಕೆ ಯಾವುದೇ ಉದ್ದೇಶದಿಂದ ಟ್ರೀಟ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು, ಮತ್ತು ಇನ್ಫ್ರಾಸ್ಟ್ರಕ್ಚರ್ ಯಾವ ಥರ ಡೆವಲಪ್ಮೆಂಟ್ ಮಾಡಬೇಕು ಅನ್ನೋದು ಗೊತ್ತಾಗುತ್ತೆ. ಸೊ ಎವ್ರಿ ಪೆನ್ನಿ ವಿಚ್ ಈಸ್ ಯೂಸ್ ಶುಡ್ ಡೆಫಿನೆಟ್ಲಿ ಸೇವ್ ದಿ ಬಿಲಿಯನ್ಸ್ ಆಫ್ ಪೀಪಲ್. ಸೊ ಅದಕ್ಕೋಸ್ಕರ ನೋಟಿಫೈ ಮಾಡಬೇಕು ಅಂತ ನಮ್ಮ ಉದ್ದೇಶ.
Cancer Day, that is 4th of February 2025. Today we had a walkathon in the premises of 2 kilometers, making a public awareness about the cancer to the public at large. Then we had many hospitals, like Victoria Hospital, KIMS, Srinivas Hospital. We had a cancer screening program and vaccination administration. This was part of the Indian Medical Association program today. Apart from that, the Apollo Hospital and in association with IMA Bangalore branch wanted to say this world, especially the government of India, that please notify this cancer as a notifiable disease, which has a lot of advantages to the public at large and the medical fraternity in general. So this is where we had a press conference to have the government of India to notify this cancer, where we can have a larger registry and easy way of treating the patients, and the post-care modalities, programs can be worked out. This is where we stand today. Thank you.